Welcome to this demonstration of how to use tracers during a Qmentum on-site survey. We're implementing the tracer methodology in the accreditation program to support standards compliance assessment. And we're not alone. Tracers have been used in industry and other sectors for years. The Joint Commission on Accreditation of Healthcare Organizations previously adopted it as well.
Bonjour, monsieur.
Tracers are defined as following the path of either a client or an administrative process throughout the continuum of care within a healthcare setting. During a tracer, surveyors conduct 4 main activities to assess compliance with the accreditation standards. Tracers can be administrative or clinical. This part of the video outlines the method surveyors use to conduct a clinical tracer, which traces the path of a client from point of first contact to discharge and sometimes beyond. The 4 main activities used during a tracer are reviewing documentation, talking and listening, observing processes and procedures, recording. Surveyors present themselves to a nursing station, for example, and ask to see a roster of current clients. They choose 3 or 4 files from the roster and sign confidentiality forms, if a global confidentiality form has not already been signed. Client files are selected based on diagnosis, number of medications, age, procedure, and the complexity of services provided. The files help determine the path surveyors will follow to find evidence of compliance to the standards. Surveyors review the client profile, referral source, care plan, and other details to develop the tracer path. File review should not take longer than 10 to 15 minutes. The review is meant to gather information to guide the tracer. It's not an in-depth review. After the review, an organization staff member guides the surveyor as the surveyor determines who to interview, specific sites to visit, and which documents need to be reviewed. Talking and listening. Surveyors go to specific service areas identified in the client file and discuss the client's experience with staff, clients, volunteers, and family members. Surveyors may return to a service area at any time if they have follow-up questions. Observing processes and procedures. Surveyors also observe the processes, procedures, and direct care occurring in the service area for additional evidence of compliance to the standards. Surveyors will talk to people on site, then review relevant documentation, for example, the policies which support the information gathered in their interviews. Tracer methodology requires that we find consistency in the information being gathered. Recording. Surveyors note their observations. They may also note information relevant to other priority processes, so they can pass this on to their fellow surveyors during the surveyor information exchange meetings. That's when surveyors discuss their findings and decide whether there's sufficient evidence to validate compliance with the standards. As a rule, surveyors will observe, listen, and confirm information with individuals, but also see it in writing. It's suggested that if 2 pieces of evidence are contradictory, a 3rd piece of evidence is sought. During this video, you'll see each of these 4 steps as they might be implemented during a tracer. Remember that tracers are very flexible. Tracers are customized to each organization and its clients, so no 2 tracers are ever the same. Martin is our surveyor here. He's going to validate the standards for critical care. To prepare, he reviewed the critical care standards and criteria and is ready to use the protocol for the episode of care priority process to guide the tracer. A thorough understanding of standards and protocols will ensure that surveyors prepare relevant questions and thoughts about who to interview and areas to observe.
Good morning, ma'am.
Good morning, sir.
Good morning. I'm a surveyor, and as part of our survey, we're doing a tracer, and I'd like to meet the person in charge of the unit, please.
A key staff member in each service area is made available to surveyors to answer general questions and help the surveyors find the right people and locations in the facility. Surveyors ensure that the organization is clear about the surveyor's role and requirements. Surveyors need access to files and people. Staff members understand they need to be available to surveyors. Surveyors won't be shy. They will be assertive in their requests to ensure they collect enough evidence to support compliance with standards. Using the episode of care priority process, the surveyor examines the health services provided to a client to treat a health condition. It starts with the first encounter with the healthcare provider and continues through the completion of the last encounter with the healthcare provider. This tracer is repeated in various service areas offered by the organization. Standards are linked to priority processes and protocols are available for each priority process. Protocols are guidelines for surveyors who are conducting tracers. Here's an example of a protocol. Note, there are questions and guidelines that will be considered by surveyors.
So what I need is a patient that was within your department for a couple of days and has been admitted to the hospital for maybe more than 48 hours. We can really recreate a good episode of care and follow the patient through.
That's no problem.
Martin reviews the client's medical history, the services received, and identifies those who provided the services. He then determines who he needs to interview and the issues he'll look into. Service providers, clients, and their families, and possibly others, are among those he might speak to. He may also decide to review additional documentation. This could include the files of recently discharged clients.
So this gentleman came in through pre-admission on the 22nd of November for surgical reasons for total knee replacement right side.
Whenever surveyors are speaking with staff, clients, family members, to anyone really, during the tracer, they will put people at ease, introduce themselves, explain what they are looking for and why, maintain a comfortable conversational style, maintain confidentiality, ask questions about the client or system being traced, and pursue their lines of questioning until enough information is gathered.
So the patient that we following today came to your unit. So I'd like to know a little bit how your unit functions.
Okay, we have the list that is prepared by the operating room. It's all decided by the hours that they're operated, so that we know when we arrive in the morning which one arrive earlier or later. When they arrive, we just greet them at the door, assign them a spot, and then we get the chart and get them prepared. And all the charts are prepared according to the time that they arrive.
And the pre-assessment, like blood pressure, vital sign, will all be done.
It's all on the sheet, and we have a lot of information in our books.
Okay.
When they are ready, they are seen by the anesthetist and the doctor before they go to the operating room that way.
So it's going to be the second time that they will see the anesthesiologist because they
Yes.
probably saw it in the pre-admission clinic. And where did the patient will have consent to that, to his surgery?
They do that in pre-admission.
Okay.
Always. It's a protocol that when they come there, they have to sign their consent at the same time.
Hey, how are you?
The patients are coming here to be prepared for the surgery, and we're doing an interview, like to have a good idea what's the health condition of the patient, and we also do a test like ECG, chest X-ray, all those tests, blood sample, and if the patient has problems, like we can prevent and ask the doctor if he wants the patient to be seen by a specialist.
Okay. So it's like a first triage before going to OR.
Yes, that's a first triage, and it's an important one because at that moment we can touch many problems. Before, when I was working, we were doing that on the floor when the patient were coming, and now we're doing that here, and we prevent a lot of problems the day of the surgery, and also for the condition of the patient.
One of the benefits of the tracer process is that the surveyor can share his experience and expertise with staff throughout the survey. In addition, surveyors will stop staff members to ask questions as they collect evidence and verify compliance with standards. They will introduce themselves and explain their role and the accreditation process. They also explain that the organization has invited the surveyor team to review its systems, processes, and procedures so they can maintain and improve quality and safety.
Tell me if you are happy to be here, if they treat you well.
For the time I was here, yes.
Yes? Good. They explained to you what's the next step, What are you going to do tomorrow? Did they told you? Yeah?
Yeah.
Good morning, sir.
Good
My name is Martin. I am a surveyor, and thank you very much to allow us to ask you a few questions today. And this will really help us to give good feedback to the organization about your perception of the quality of care that they provide. In general, are you happy about the services that you receive in the organization?
Really very happy. That's
You're
my
happy?
second knee down here.
So now you have a brand new bionic knee?
Yeah,
Yeah?
the left one and the right one.
Okay. Did they explain to you the entire process of having a knee surgery?
Yes, yes.
It's important to remember that surveyors will verify the information they get from interviews in a number of ways to ensure compliance with standards.
I need to know, to understand a little bit how this unit is functioning.
Okay.
So can you please bring me through if I was a real patient and I will be admitted in ICU?
Okay,
So explain
sure.
to me the process a little bit, how
Okay.
how the patient will come and
Sure.
how you will deal with them.
Sure, no problem. Usually the patient comes up either from emerge or for the floor, accompanied by a registered nurse
Okay.
and a porter. We usually come into the room. The room is usually undone.
Okay.
This is a typical ICU room. There's the bed, which is usually undone with patients. The patient will come in. We'll
Okay.
transfer the patient.
Okay.
Sometimes we won't let the patient transfer themselves due to the reason why they're up here.
So the person from the unit will also be with you, like the
That's
person
correct.
from Emerge or from the unit will be with you.
That's right.
So how are you going to transfer information about the patient? Maybe you can explain to me what's your relationship here with the nutrition department and the external provider. How do you make sure that the external provider provide you good quality food?
Well, there is our suppliers from HFS, which is a hospital food service, and it's all the foods are, well, most of the food are provided by them, and they give us nutritional content, so the ingredient list, the nutritional value of all foods, and then we can adapt it to the standards.
Can you explain to us a little bit what you have done on that surgical floor?
I'm the pharmacist. I'm working on the surgery unit, and the project consists of collecting information from a patient who had resection intestinal, and the nurse has complete the list of reconciliation form, and I reviewed this list with the patient in a post-operative period. And if there is a gap between the medication ordered by the physician and the list of the medication the patient taking at home, I call the doctor to prescribe,
complete the list.
complete the list.
To complete the
Yeah,
list.
to complete
Okay.
the list.
So is the project was useful in order to improve quality of care based on your perspective, on your perception?
Oh, yeah.
We have a patient that has been admitted now in ICU.
Okay.
And that patient had a problem post-operatively, but it's a patient that had a complete knee replacement.
Okay.
So can you explain to me a little bit, how do you work with other discipline in order to provide the best quality care to that patient and to make sure that he will go home early and can still function in a very adequate way when he's back home?
Okay. Well, first of all, we always see them before their surgery to explain how to prepare for it. We take measurements and we explain the exercises and what equipment they should get. And we see them the first day after their surgery. And of course, we communicate regularly with the head nurse so that we know if he had a bad night or any complications, we'll be aware of that. We also write notes regularly every day in our charts so that the surgeons can see the progress they're making in physiotherapy.
Okay.
And we can always talk to the surgeons. They're always usually there early in the morning on the floors.
Is one interdisciplinary team set very specific goal for that patient?
Yes.
During this tracer, Martin spoke with both staff and clients. This in addition to his visits to many different areas of the hospital, all to follow the path of a single client. Remember, Martin could also have spoken with the client's family, larger staff groups, or others pertinent to his tracer. Surveyors conduct these tracers alone, but on each day of the survey team meets to share the information and evidence they've collected from their individual tracers. This is an opportunity to verify and agree on their findings before entering them into the surveyor software tool.
How are you?
I'm fine. What about
Good.
you?
You had a nice day?
Yeah.
Maybe we can share some of
Okay,
the
that's a
stuff.
good
So,
Okay,
Now-
so what did you get?
Remember, each tracer follows a path or a procedure from start to finish. They all allow for interaction and sharing of information with staff. Tracers help to educate staff about accreditation. And remember this defining feature: tracers are unique and flexible. Just as no two people are the same, no two paths of care are the same, no two tracers are the same. Like the paths they take, surveyors, staff, and clients must be open and flexible for the tracer to succeed. And a successful tracer helps all of us improve the quality and care that we provide to Canadians.